Hello, my dear friends. Namaskaram. Good morning and good evening, and a warm welcome to one and all of you. As always, it gives me a great pleasure to be part of these sessions and really want to be thankful. I would say be thankful to God who enables such sessions. And today, yet another session. It's a motivational series, and each time we come to the session, we come with only one objective and one motive, that is to build the mankind as overcomers. Today, many of us are going through various struggles in our lives, and the sad truth is, there isn't enough counsel available that people are able to get that awareness, get that courage, and therefore they are able to get these ideas to overcome, get this advice to overcome. And that's why these kind of sessions are very, very important, and do not miss on it. And you want any other specific topics, please write to us. Yet another session, yet another topic, and the title of this topic would be, why are people of this generation so concerned about their health? Hmm? So, the title itself conveys that people who belong to this generation, roughly from 2000 onwards, right, in the new millennium, the reason could be various factors, and that's what we are going to review today. It's not a bad thing that you should be taking care of your health. It's not a bad thing that you should be concerned about some of the sicknesses in your body, some of the diseases, hereditary diseases, or genetical problems, and you may want to work with your doctor and you may want to take it through a solution. You don't have to suffer because of various reasons that we are going to review. The main primary reason is technology has really improved. The medical science and inventions associated, they've done a fantastic job. There are phenomenal number of discoveries that have been invented through inventions from the medical science and people who study for medicines, and there are a lot of people who have opted for R&D. They didn't want to become like set up a clinic and become doctors, but they are involved in R&D and research and development, and a lot of biotechnologies, biomedical science, all this kind of courses are also available in engineering these days. And those people's brilliance really deserves a great appreciation and big applause, because without these people's contributions and efforts, today you would not have many technologies that is really serving to the needs of the mankind. One good example is, for example, the CT scans were there before, but MRI scan even is more accurate. And now they are actually discovering many things, like you have to just take a spit and put on your the device or something like that. It can detect and tell whether there are any opportunities for cancer, and even a simple blood test is able to detect and help us to find out whether there are any kind of anticipations towards cancer or not. So many things have really brought us towards the side of anticipation, clarity, transparency, and you don't have to lose your life unnecessarily for no reasons. You have to lose your life. People, for example, in early 1970s, 1980s, there were a lot of people who lost their lives because of jaundice and so many other diseases, which are easily handled today, right? Tuberculosis, TB, because of recurring phlegm secretion, and it could not be handled, and they get that congestion in the lungs, and they end up with wheezing and asthma and stuff like that, and they are dead and gone. And a lot of people who didn't even know that they had some cancerous elements in their bodies, and they died one fine morning. And many people have died of cardiac arrest and heart attacks. Nowadays, if you see, you can go to the cardiology department, they will just insert a do a echo test, and they insert a kind of device which can clear any blocks, which are easily handled. If the block is really more, for example a cholesterol block or something like that, they have a new technology called a stent mechanism, and they induce the stent and they kind of free up the arteries. Therefore the blood flow is again once again kind of harmonized within the body, and therefore they don't have to go through the death or something like that. The life is saved. So big thanks to the technology, big thanks to the medical science, and big thanks to the awareness this medical science is bringing. The other day I was going for my eye checkup, and there's some little power variation, and they gave me spectacles to wear. And during the point of time, I saw a poster, please ensure that you do the glaucoma test. Now, a decade or a couple of decades ago, there wasn't any awareness like glaucoma. And glaucoma means if there is some sort of deficiency in eye pressure, you can end up blind. And many people have gone blind because of this problem. For that, they have a very simple test to be done. They can detect and they can treat it with the simple eye drops. You don't even have to go through surgery. So, a big thanks to all the medical folks, and hats off to your service to the society. Really appreciate. These are the positives. Now, what are the negatives? Could there be negatives at all? My friend, whatever you had been talking so far, it's so good. What is this negative side? Negative side. Let's rewind the tape towards 1970s, 80s, or early 80s, where I was a 5 or 6 year old boy. And whenever I go to the doctor, he will have bunch of tablets right in front of him. If you have fever, fine, take this yellow tablet. If you have body pain, chills and all that, take this yellow tablet and white tablet. You have loose motion also, take this yellow, white and blue tablet. Something like that. If that again you go and meet him after 3 days, this is really helped us, but I'm not fully cured and this and that. Then he'll make you to lie down on your stomach, and he will inject something in your butts. That's it. You will be completely fine. This was the kind of treatment whatever I had been going through during my childhood days. And say for example, if I had fallen on the ground while playing and all that, we'll be taking mud, we'll be spitting, and we'll be making a ball and then putting on the wounded area. Mostly it happens in my knees and in this elbow, forearm and all that, right? And that was a common treatment. And believe me or not, in a day or two it will be fine. Actually, the pain, everything will reduce. Then only I have learned from one of my Ayurvedic friend, there is a lot of medicinal effect in the mud and the spit that we have. That is the reason. So nature has taught us that to handle certain things this way. But today, if your kid is falling down, immediately you rush to the clinic, and the doctor takes up a TT injection, and then he injects. Oh, there is a mud scratcher, there is a tar road scratcher, man, this will get septic and all that. You will be quickly prescribing some 2 3 ointments, one for antiseptic, one for healing, one for drying, one for this bathing, this and that and all that, and bandage. So you will end up spending so many thousands of rupees, including his consultation fees. And at the same time, you know what is the important part to be noted? Some of the medicines do have steroids in it, and that can affect your kidneys, liver. That can affect even many vital organs of your body. And these are the post effects. These are the post consequences where the mankind is not watchful. What are we trying to say? And at the same time, some doctors you go, some hospitals, I did not name any of them, for even for simple thing they will ask you to do these many blood tests and these many scans. That's not the way how medical science used to operate, right? Yes, of course there were lack of technologies and all, there were lack of technologies, I don't disagree, but not necessarily for everything you need to send a person for a CT scan or a what is that radiotherapy scan, right? In the stomach they will be doing some scan. I forgot that name. Ultrasound scan, sorry. And worst case they will also send you to MRI. Some doctors say, do you do both and you come to us and all that. It is not definitely needed in all the cases, but yes, there are complicated cases where you definitely have to go through this. This is the reason half the population refrain going to doctors, because the moment I go, this guy will give me a big list of things. Without report, I can't even examine your body. Some people make this kind of statement, and they're very rash also towards their patients. And awareness, what we are trying to create here is try with some home therapy, right? For example, you get a simple cold and cough. These days, any cold, any cough, immediately they take a COVID test. Why NTPCR test they take? Why are you doing that, right? You don't have to. You have taken vaccine, right? And then you are fine. And immediately a cold or a cough, immediately consulting an ENT, and out I will tell you, 5 out of 10 ENTs they immediately prescribe an antibiotic. Antibiotic is no good for your health. Why? Because it will only lower your immune system. Next time the same bacteria comes, your body won't be resistant to that bacteria, right? Therefore, you need to allow enough time for the body to handle. Body has a very strong autoimmune system, and antibodies are being produced and released from your body. Each time it is kind of thrown to prone to infection. That's why fever is coming up as an indication to the body, to the brain, and all the functions within the body, that there are a lot of white blood cells needed to fight against. That's why when you take a blood test, white blood cells will be on the higher side when you have an infection, because it is fighting against the disease that is in your body. Allow the body, our body is strong enough to fight against any disease. Extreme cases, there are certain cancerous things and certain kidney related problems and liver function test and this and that you can take yearly once. Yes, please go through a regular checkup of your cholesterol levels, of your take a kind of a routine urine check, and kind of blood sugar test, and the thyroid stimulating hormone thyroxine is very important. Take that. Go for a yearly once eye checkup. If you have power issues, go for a dental checkup yearly once, no problem, all these are good. But then the moment you get little bit of inconvenience in any part of your body, give it enough time. The body itself will settle down most of the times, 8 out of 10 times. If it cannot, for example, I had a decayed or a bad tooth, and I could not give that time. Why? Because the pain was not settling down. I took almost so many painkillers, and then I had to go. They asked me to take an x-ray, and then we have to, did not plug the tooth, root canalling was done. Those are extreme cases, you can go. So what I'm trying to say here is, these days the awareness, the technology, and the number of hospitals and the clinics, those days no clinics were there, so I mean to say specialty hospitals were there, like a kind of a motel, right? It's not a typical hotel, but it's a kind of a small facility, similar to hotel, something like that. Today you will see a lot of specialty hospitals where consulting doctors will come. Those days it was not the case. There were hospitals here and there, but there are clinics where the doctor himself will sit, but not 24 by 7. But these days so many specialist diagnostic centers are there where they function 24 by 7, and of course they are good. In emergencies you can reach out, but sometimes they are bad too. Why? Because immediately you get the temptation, okay, let me go there, this doctor is coming at that time. And on the skin, something like some kind of rash, immediately rushing to the doctor, and he will be prescribing some steroid medicines, and then you take it. My ultimate point I'm trying to make here is, our body has been wonderfully, beautifully created by our God, and the body is definitely a self-healing instrument. It knows how to handle if there are any problems in the body. Give it enough time. However, have a good work-life balance. Reduce your stress. All these are needed. Go for a regular walking and check your weight once in a week at least, and check your periodic review and assessment with your doctor with your health report yearly once. Do it 6 months once. In some extreme cases, genetical disorders, do it. But otherwise, if you're able to do your daily activities, if you're able to climb up stairs, climb up, climb down, you don't have to be scared of anything. Especially if you're alcoholic, if you're a smoker, quit today. Why? Because if you're alcoholic, if you're a smoker, then you have every chance of dying early. Why? Because both of these will reduce your lifespan, about which we have again done a different session. You can go through it. The ultimate point is, do not be overboarding yourself and way too concerned on your health. Why? Because the technology is definitely a temptation. The modern day awareness is also another magnetic pull. All these things will always kind of lead you in a pathway where you will be prone to take too many medicines, and your kidney doesn't have the capability to handle those many medicines, steroids, painkillers, and even paracetamol for that matter. Take in a regular dosage. Too many dolo 650s and too many medicines also is going to really have a problem. And learn to be little more patient, tolerant, when as far as your health related matters are concerned. Don't be over concerned. And another thing is, yeah, I forgot to tell you, Google. You forget this Google doctor. Okay, you can Google, but then the moment you type anything, headache, no, immediately it will say there is a brain tumor. Yeah, you have a fever, immediately he will say that you have a cancer, something like that. So you need to really, you can Google, but you need to handpick, and you need to really extract what is needed. And anything beyond what is needed can really endanger, it will spoil your mental system. You will be, you bother with too many worries. Yeah, too much of knowledge is also pain. Too much of knowledge is dangerous. So you don't have to get into too much of education, because you are not a doctor. Instead of spending time Google doctor and confusing yourself and all that, go to a doctor, right? And the last tip that we want to leave behind is always work with the doctors whom you had been working with for a very long time, right? For example, I have 6 7 doctors. I don't go to any one of them, any other doctors other than these guys. If they're out of station, I will bear until they come. For example, ortho doctor, an eye specialist, general physician, and kind of endocrinologist with whom I can work on my liver, kidney, and all that yearly once I go and check it up, and all these things you can do. But no, but then you go to a new facility only on emergency basis. But other than that, continue to work with your regular doctors and do not change anything. Don't ever call them and say outdated. This guy is now 80 years old. What does he know? No, no, no. I'm telling you, they are definitely having a lot of updates on the new technologies, but most of the times the old methodological way of approaching a problem with starting with the basic analysis and diagnosis really works. That is enough most of the cases. I told you already, extreme cases, emergency cases, fine, rush to a nearby hospital, a reputed hospital, and go get yourself treated, right? All these things please consider. Why? Because I know in this modern era all people are very smart. They know how to use technology, they know how to get access to the with the health facilities, and the social media is also very strong. Moment you post, do you know a good dentist, they will give you 20 references right? But you do not know who is best, who is bad, who is good, bad, and ugly, right? That's why you should research properly, and each time when you visit a doctor, if there are any online reviews, post your review. That helps another person to pick the right doctor in case if they don't have a doctor, right? For example, you have migrated to a new place from Bangalore to Mumbai. In Mumbai you knew not anyone, therefore how does the person pick the right doctor? Reviews like this will really help. Okay. All right, with this I close this session. I hope this was a useful session. Therefore, do not overboard yourself, do not be over concerned about your health. Any infirmities or any kind of afflictions in your body can be handled by your body itself. Therefore, give it enough time. 8 out of 10 problems will be solved by itself. And the remaining 2, it's not solved, then yes, go. You consult a doctor. That too, start with your own circle of known doctors. Then they may refer. Sometimes they are not specialists in that, they may refer. Then go with their reference. All right. So stay healthy. Health is wealth, so stay wealthy and stay blessed. And please do not forget to subscribe to our channel, and share these details with your friends, videos you like and all that. Please invite them. Why? It is going to only help the mankind. Our objective is to build the mankind as overcomers. Fight it out. Always stay encouraged. Thank you very much, and talk to you soon. Namaskaram.